Hi, everyone. Welcome to today's Research America Alliance discussion. I'm Ashley Arbasati, the Senior Director for Global Health R&D Advocacy. Thank you so much for joining on Zoom today and for your partnership in our Research America Alliance. If you're not an organization, if your organization is not a member, please join us. The one way to get in touch with my colleague Joel. He's happy to connect you to discuss the value that comes with being an Alliance member organization. I believe his email is being dropped into the chat now. Our special guest today is Dr. Dylan George, Director of the Operations for the Center for Forecasting and Outbreak Analytics at CDC. Before joining CDC, Dr. George was a Vice President at Ginkgo Bioworks, where he helped develop improved real-time infectious disease monitoring capabilities in analytics for pandemic response. He recently also served on the Biden-Harris transition team, working on national security policy for the COVID-19 response, and on the agency review team for the Department of Health and Human Services. Today, Dr. George will be discussing the innovative work of the Center for Forecasting and Outbreak Analytics in its very first year of operations. As always, please type your questions into the Q&A box or chat, and we'll pose as many as we can during the Q&A portion of today's session. Thank you again so much for joining us, Dr. George. Over to you.
Thanks, everybody. It's great to be with you today, and you may have noticed my picture is slightly different than my appearance right now, partly due to the pandemic has impacted all of us in different ways, and mine was through growing my hair out, and I like to describe it as like my hair is like the pandemic. It's lots of waves, and the longer it goes, the more tragic it is. And so it's but it's wonderful to be with you all today. Thank you for the invitation. I'm thrilled to share a bit about what we are building at the CDC and the Center of Forecasting and Outbreak Analytics, and we're really excited about what we're doing. And the capabilities will be critical to putting an end to pandemics. I know this is an ambitious goal, but I think that our efforts are not without merit nor without reason that we can actually put them into practice. Next slide, please. To lay the groundwork for this afternoon's discussion, I'd like to start by taking us back to the year 1900 in Galveston, Texas. At this time, Galveston is a thriving, booming city. It's an up-and-coming golden city of the South because of all the economic activity and trade and transport that are going through that location. Unfortunately, in the first week of September in 1900, the Galveston Weather Bureau begins receiving reports from ships that a storm is brewing. Unfortunately, the Weather Bureau wasn't able to pull in all that data to analyze it and to actually send out information warning residents in an effective way. And what happened was the hurricane made landfall right over Galveston. Now, at the time, there was about 40,000 people that lived in Galveston, and unfortunately, somewhere between 6,000 to 12,000 people lost their lives that day. Every building in the city sustained damage, and the total economic impact was well over $1 billion in 2020 adjusted dollars. It was absolutely devastating, and it was one of the deadliest hurricanes in US history. Now, the Galveston hurricane and subsequent similar natural disasters have made improving the nation's weather forecasting capability a top priority. And so fast forward to today, we can predict storms with incredible accuracy, days in advance, allowing for critical time to amass resources, shelter people, move people out of the way in terms of evacuations, etc. Hurricanes are still devastating. There's no doubt about it based on what we've seen from this hurricane season. But we're able to save more lives because of early warning. Early warning buys us time to make the best decisions for our families and for our communities to diminish the impact of the oncoming storms. Now, I say all of this that forecasting is an incredibly powerful tool that can inform and improve our daily lives. And a good example of this definitely is weather forecasting. We all use weather forecasting in some capacity. I was just on a trip recently. Before I went to where I was going, I checked the weather, what it would be at the location I was going to be at, to determine what I was going to pack to take with me. We look at it if we're going to leave the house early on our daily commute to know if we have to confront rain and the congestion, the additional congestion that would put into place. So we know how to intuitively use forecasting to change our behavior in moving forward. In fact, this is done at scale. We think about how materials are moved around the world. They use weather forecasts to optimize moving material and in different places, people and material. So early warning and weather forecasting provides us undoubtedly useful capabilities and has been intuitively ingrained into our society in different ways. Now, forecasting is not only applicable to weather, it can be useful for disease situations as well, disease outbreaks. Early warning and accurate forecasting can save hundreds of thousands of lives and buy our healthcare infrastructure valuable time to prepare for surges in infections and hospitalizations. So as we've seen over the last 2 years, 2+ years with COVID, and now with monkeypox and Ebola in Uganda, pandemics threaten our families and communities at speed and scale. And what I mean by that is outbreaks happen very quickly and they happen to many people or communities at the same time. Our response to these disease threats needs to move at speed and scale too. Acquiring quality real-time data that we can rapidly interpret and apply to our outbreak response efforts is critical if we want to avoid the devastation that is caused by these outbreaks. Now, unfortunately, the COVID-19 pandemic has cast a spotlight on some of the challenges that the federal government, including the CDC, has faced regarding public health data acquisition and use to actually confront disease burden within our communities. Specifically, CDC historically and currently does not have data authorities to require states and jurisdictions to share public health data that they collect with the CDC. It leaves us spending valuable time piecing together data from systems and sources that don't talk easily with one another. Similarly, we don't have data systems that make it easy for jurisdictions to send data to the federal government. If we want to respond better as a nation to disease threats like COVID or monkeypox or Ebola, we've got to position ourselves to get real-time data and usable tools to rapidly analyze and share what we know with leaders at the state and local level to help them inform decisions in a timely way. Outbreak analytics and forecasting is as essential as weather forecasting, and it will ultimately save lives and diminish the devastation that diseases cause. These capabilities to do these outbreak analytics and forecasting, in part, are here now, but they're not equally just distributed. So it becomes a question of equity and sustainability and capacity. So the questions we have to ask ourselves, do localities and states have the funding and support to maintain and build these types of tools so that we're ready when the next disease outbreaks occurs? How can CDC more collaboratively work with these decision makers to support their forecasting and outbreak needs? And what is the most effective way to do it? These are the questions that are kind of pressing right now. Now, to answer these challenges, Congress authorized and the Biden administration created the Center for Forecasting and Outbreak Analytics. And for those of you that speak federalese, that's CFA. So CFA was charged with using data and outbreak analytics to inform real-time decision-making for public health crises. In short, we're building a national weather service for public health crises like pandemics. So if we want faster and more effective outbreak responses, then we need the data and analytical systems that will support it. We need real-time data, better scenario modeling, better forecasting, and better ways to share those analytical insights so responders can make better decisions. We can do this, and that's what we're working on at the Center for Forecasting and Outbreak Analytics. Next slide, please. So where does CFA fit into this pandemic response? At CFA, we are building the teams, tools, systems, and partnerships that will help us assess the risks from an outbreak, anticipate its trajectory, consider what interventions would be most useful, get the critical data that we need to move forward, and inform responders to enable actions to stop it. We are building a toolbox of analytics to help guide action in health emergencies. And so this is a cartoon that I like using and talking about how the progression of a pandemic happens from those animal sources. It comes over into a zoonotic spillover to an index human case, stuttering chains of transmission until they either stutter out or they go into a bigger outbreak, an epidemic, and then a pandemic going forward. The box underneath, the blue box and the green boxes internally, is representing different types of analytics that are necessary early in the outbreak, midway in the outbreak, and towards the end of the outbreak to help us understand, is something happening? How do we understand and characterize the risk of it? To whom is it infecting? How is it infecting them? Then also determining what types of what if questions can we actually inform and think through in terms of doing scenario models, and then forecasting what is the trajectory going on. We need to build that toolbox, and we need to make it broadly available going forward. And so this is the type of thing that we're moving forward with on right now. Now, CFA has been around for about a year now, and so we're actually have some successes in where we're going forward in using data and analytics, because we've had to actually try to help out with a couple different outbreaks right now. And so there's a couple different areas of successes where we've shown this. First, in technical reports, we've developed 3 and counting. We're developing a couple more technical reports to rapidly analyze what we know about the monkeypox outbreak and forecast the outbreak trajectory in the United States. And we've been sharing that with the scientific community and the public. If you just type in CDC monkeypox technical report, they will pop up and you'll see the types of work that we've been working on with our colleagues within CDC. We've been engaging with academic modelers as well. I mean, we've been supporting the CDC's polio response by helping them estimate potential risk of paralytic polio in different jurisdictions. And we've been facilitating engagements with external academic modelers to discuss this work in different ways to help them scope their efforts. We've also been developing technology and tools. We've been piloting a virtual analyst environment that creates common operating picture for disease modelers to collaborate and share code and allow decision makers to ask questions in real time. And that's under development moving forward. And we've been able to actually get critical data and do analyses on the fly as well. You may have remembered back in last Thanksgiving, when Omicron was on the scene, we were able to work with Kaiser Permanente Southern California and UC Berkeley to produce the first US estimates of the Omicron severity compared to the Delta variant. We were working with collaboratively with a team of academics and experts in the office and the administration for preparedness and response, so that they have those sorts of capabilities going forward. So we've had some early success that our strategy and use of advanced analytics is actually useful for helping in response settings. For it to work on the scale of the nation, though, we must scale this capability across the United States. And to scale this capability, we have to talk about our public health infrastructure. Pandemics and outbreaks are local events. They happen locally and we respond locally. So we need to support local decision makers to keep us all safe. We also know that pathogens don't recognize our political boundaries. Borders by themselves, as we all know, don't stop a pathogen spread. To adequately address pandemics or stop pathogens before they become pandemics, we must develop an infrastructure that enables us collectively to respond to these threats. So how does CDC and CFA meet this need to work collectively to respond to these these outbreaks and before they become pandemics? Well, there's 4 big imperatives that I see to address this challenge. First, we need the data at the speed of need. CDC and CFA needs the latest data in real time and data scientists who can rapidly analyze and interpret this data. So we're building these teams to do this kind of work. So CDC also needs stronger data authorities to ensure states, localities, and territories are sharing that public health data that they collect. And we need highly skilled data scientists, engineers, project managers, and communicators to interpret that data, to analyze it and interpret it going forward. So we needed data at the speed of need. We need evidence for action. CDC needs better, faster mechanisms to relay our understanding of data to the public and key decision makers, to politicians, to public health departments, to mayors, to superintendents of schools, hospital systems, doctors, et cetera. We need evidence for action and put that into place. We need to be enabling in all of society response. CDC needs to partner with private sector entities and academics to set attainable goals, break down the silos of public health data so we can all work much more effectively together to do this. And we need innovation. We need to integrate novel data sources into outbreak analytical tools such as wastewater, genomic sequencing, mobility data as examples, also behavior-related surveys. Those all need to be incorporated in different ways, and we need new methodologies to do that. We need to enhance those analytical tools at the federal, state, and local levels to respond precisely in a more impact way. Now, as I said, with pandemics are local, but and CFA was established about a year ago, or back in April in 2020. So our team has been working hard, and we've been trying to walk and chew gum at the same time. We've been trying to grow our team and build our capabilities and our tools and our technology, but we've also been trying to help out with monkeypox, COVID, polio, and Ebola. And so our 10x value proposition really is providing that analytical insight to the federal government. And this is just the beginning. Our value increases to 100x, or 100x value proposition is if we can do the same sort of thing for state and local jurisdictions. And that's the brass ring. That's what we're really pushing forward in a different capacity. So next slide, please. So as we continue working to bring the CFA to scale, we are focusing on establishing and growing public-private partnerships and partnerships with academia. So that together we can match the technology, tools, skills, and capacity for innovation within these groups to bring together the expertise, reach, and mission of CDC to achieve our primary goal of saving lives and protecting people from these public health threats. We're also investing in partnerships with academia and private industry in a couple different ways. Some of our recent funded programs and projects include, we have invested $5 million to state and local public health organizations to help understand their forecasting and modeling needs to inform critical decision-making in a time of crisis. We've also developed a $24 million effort with the Nursing Home Public Health Response Network to perform rapid quality data collection to inform real-time policy decision-making going forward. We've put $3 million over at the Department of Energy to leverage its high-speed computational power to scale our virtual cloud-enabled modeling environment and to try to generate a next-generation modeling capability that way. And more than $6 million have gone out to our academic partners across the United States to advance disease forecasting science, technology, and other different workforce efforts in going forward. So we're trying to find a range of ways of partnering to advance these disease forecasting capabilities. Next slide, please. At CFA, we are doing this work with 4 key principles at top of mind. Clearly, mission impact is what we're focused on. We are a response organization. We are going to be enabling better responses. So that's critically important in all the thinking that we go forward. Second is transparency. We will make our data analyses, scientific methods open to the public so that others can see what we're doing and can replicate it if they need to and if it's useful at their jurisdiction. Also, we want to be able to have reproducible science going forward. And if there are, heaven forbid, mistakes or errors in our code and our data and going forward, we want the help from external groups to help us spot those so that we can move forward more effectively. Equity focused. We want to build capabilities that will be useful and protect all Americans, not just some Americans. So we want to achieve those health equity objectives. And then collaborative. We are committed to working with partners in the public and specifically the private sector and academia and civil society to maximize our impact. Now, I've spent some time this afternoon discussing the importance of high quality real-time data in our outbreak response efforts. and how CFA is joining the many organizations doing this work together. Our goal is to add value to the nation's public health system through forecasting. This work is already taking place at various locations and levels, and we're trying to accelerate that in a couple different areas. So next slide, please. Now, this is a slide that I like discussing as well, because this slide right here describes numerical weather forecasting skill through time. So if you look on the x-axis, it's decades. If you look on the y-axis, it's some sort of measure of forecasting skill. And what you're seeing in these blue and red lines going up to the right is that back in the 50s and 60s, essentially, we were pretty rubbish as a nation in doing numerical weather forecasting. And we've progressively gotten much, much better. To the point today, again, we all have a mobile device and we all have weather apps on that, and we all know how to intuitively use that information to guide decision making and change our behaviors in different ways. Now, what has allowed us to have that monotonic increase and sustained increase through time? Well, it's been a couple things: data, models, people, computational power, and sustained funding from the federal government. The United States federal government and a couple other governments across the nation, across the world, have actually put that money into this to move this forward in different capacities. So that's how we've sustained it. Now, if we were to actually say where we are with disease forecasting, unfortunately, we have to say we're back in the 60s, 70s kind of era. We need to move much more effectively. We need to mature this capability going forward. But one of the reasons why I left the private sector to come back to the federal government is because I think that we are at a transformative moment in history. We all know that we live in an era of epidemics. Not only are infectious diseases threatening our families and communities, as we've already talked about, but they also threaten our national security. We also live in this era of great technological advance, particularly data technologies. Data technologies have transformed our society, but they have not transformed public health. The time to change that is now. We have the resources, the vision, support from leaders. We're building the partnerships and the teams. We can meet this moment together. We can all play a role in this transformative moment. And that is why I left the private sector to come back, because I see a clear path for us to actually make significant progress, not only as a science, not only as an operational capability, but as something that will keep Americans safe. I am extremely proud of the team that we're building and the capabilities. It's been one of the best teams I've ever worked with, and I'm proud to be associated with them. Next slide, please. So as I mentioned, I am very hopeful about the opportunity the Center for Forecasting and Outbreak Analytics holds for the future of pandemic response in the United States. And I am very much looking forward to thinking about how we can improve upon what we're doing. Now, if what you have seen here today, if is intriguing to you, if what you've seen here today, you see areas of, and opportunities of actually helping us do what we're proposing to do, please feel free to reach out and to search for available job opportunities, because we are heavily recruiting right now to build our team going forward. And so we would love to hear from you and love to talk with you about how you could be a part of what we're building going forward. So I will stop there. Thank you so much for your time, and I would be honored to kind of continue the discussion and answer any questions you might have. Thank you very much.
Wow, that is a huge amount of information and a huge amount of work that you've done. And I amend my former, when we were chatting before the Zoom, that I now think you and your team are one of the people that outsource sleep in order to be more productive. And the presentation and really proves that. I love the emphasis on health equity. And I agree with you. It does feel like we're in a transformative moment in time where we can actually put in work to set ourselves up to be better prepared for outbreaks. There's a saying in the community that, pandemics are a choice, that we can choose to stop them. We just have to invest in this. And I think your team is making America safer. We have some outreach in the chat, but before we do, I'm going to take a moderator's choice preference role and ask you if you can talk a little bit about the gulf that exists between advanced analytics and outbreak forecasting tools and technologies in the research and development or academic space, and those that are available for use in applied public health practice. Is there any ideas for addressing those gaps?
Yeah, it's like after 9/11, during 9/11, there was those attacks with anthrax, and we realized that there was a significant valley of death associated with medical countermeasures in terms of vaccines and diagnostics and various therapeutics. In short, what that meant was there's amazing work that was being done in the academic community, and they were doing really incredible things, but there wasn't a market for pandemic products. So there was no way to pull that science across the valley of death so that we would have capabilities ready for a pandemic. So we built BARDA, the Biomedical Advanced Research and Development Authority, to actually bridge that gap, to move material over. And we've reaped the benefits of that in part in the COVID response. They were partly responsible for the advances that we had with the mRNA vaccines that were so instrumental in blunting the impact of COVID. Now, there is a very similar valley of death associated with data technologies because, there's multiple trillion-dollar companies in the United States, and we've developed the data technologies and revolution here in the United States, but we don't have a market for public health analytics. Therefore, we have amazing research that's going on in the academic communities to develop different analytics, use different types of data to understand how things are going, but we don't have these products that will actually be able to use and be operational for in a time of crisis. So we need to figure out how to bridge that gap in a similar way to what BARDA did. And so that's part of what we're going to try to do with the Center for Forecasting and Outbreak Analytics, is try to find these capabilities that exist in the commercial space for commercial purpose and bend them slightly so that we can actually advance our capabilities in a significant way and leverage what's already there instead of rebuilding these capabilities de novo. Yeah.
I think breaking down those silos is the first bridge to cross there, especially when we're talking about using private sector, engaging academia. I noticed that you put civil society and also agencies. I think that that's a wonderful and much needed approach. I think that would be interesting to a lot of our alliance members as well. Do you kind of have an idea about what these partnerships or this breaking down those silos, what might entail, what it would look like?
Yeah, no, it's there's been a lot of work being done on trying to understand different pathogens and going forward. Now, it's CFA is going to be kind of like thinking about a capability, a cross-platform capability to think about almost a disease agnostic sort of approach. So instead of thinking about what are the disease-specific sorts of issues, which is really valuable and important to understand, to have deep understanding of, but how do we actually develop a cross-cutting capability so that we can actually be ready in a crisis situation, regardless of what pathogen is out there, and so that we can make sure that we have that capability ready to move very quickly. Now we have to augment that the analytical capabilities with the subject matter expertise in a particular area. For example, with monkeypox right now, you had to have expertise from monkeypox, but you also had to have expertise from the STI community to bring that together in a more meaningful way. And you had to have the analytical capabilities to go forward. So you have to figure out how to bring all that together. We're going to be focusing on almost a vertical instead of a horizontal approach to building capabilities instead of doing deep dives into specific silos.
Fantastic. I do note that we have some questions in the chat. One of those, can you share more about how the CFA is working with existing programs at CDC, which is a great question, such as the Advanced Molecular Detection Program at NCEZID, which deploys genomics sequencing to characterize pathogens quickly and accurately and hopefully early.
Yeah, no, we're keenly interested in trying to find ways to work with some critically important programs within CDC. And so the Advanced Molecular Detection Group, or AMD, if I'm going to I might flip into federalese here. So it's definitely AMD. We are keenly interested in what they're doing, and especially like the nowcasting capabilities that they've developed is really wonderful. We're quite interested as well. This is one of the areas of innovation that we think is going to be very fruitful, is thinking about how do we take that genomic sequencing data and bring together the metadata from clinical data to actually have a much more robust data set, and what can we really interpret, and what can we actually intuit from that information in a much more sustained way. We're trying to think about, actually, we're jointly funding programs right now with AMD to actually move that kind of idea forward. But I'm confident there's going to need to be much more work in there to see how we can push nowcasting even further along going forward. But I completely agree with you. It's like developing interesting capabilities with genomic sequencing is going to be critical. One thing that I will note, though, too, is that it was interesting. It was like 5 years ago. I was at a meeting with folks from AMD and a couple other sorts of academic institutions, where we were actually at this meeting trying to convince people that genomic sequencing was going to be useful for outbreak response. And today it's a foregone conclusion, and it's broadly accepted that this is a capability that we need to go forward. And so, 5 years is a long stretch of time, and a lot can transform in capabilities going forward. And so I'm very hopeful that our joint kind of work together will yield something that is going to be exceedingly beneficial for responding to outbreaks.
Thank you. Thanks for that. And before I know that there's lots of, gosh, the chat is fantastic. This is great. The one thing I'm just going to ask one more of my questions, then I'll kind of focus on the chat. I noticed that in your slide 2, there was the focus on zoonotic spillover events. Is that where CFA is going to be focusing exclusively? I know you also mentioned polio, but is that kind of the area where you're focusing the most time?
Thanks for that question. It's really important that we have a clarification there too, because in terms of zoonoses, there's some really interesting sort of programs that are trying to develop a better understanding of anticipating when you would have an emergence event or when you would have a spillover event. We're actually not going to be focusing on those areas because those programs, both like at the National Science Foundation or USAID, are developing capabilities in those spaces fairly well. And so we're going to be somewhat more laser focused on, once an outbreak has started, what is the trajectory of that going forward, and how do we actually galvanize resources in a much more precise way to actually drive the response. And so that's going to be kind of like almost a division of labor and the complementarity there. We'll be definitely keeping an eye on what's happening in that space because definitely the research has to mature so that it's an operational capability. But we're going to try to infuse our capabilities much more deeply into kind of like the operational tempo and cadence of what's going on in an ongoing outbreak.
Okay, great. Thanks for that clarification. So I'm going to turn to the chat, and apologies if I don't get to your question or if I kind of condense it. There's just such amazing amount of brain power here. From Pia, she'd be interested in hearing from you if there's a role for NGOs and nonprofit research entities outside of academia.
Yeah, no, that's a great question. Thanks for asking. One of the things so the answer is yes. We would have to figure out how to engage more broadly. I mean, one of the things that I am constantly thinking about, though, too, is that in the early stages of the pandemic, we saw what the Johns Hopkins University did in terms of bringing data together, putting out dashboards. We also saw what COVID Tracking Project did. They did an amazing amount of work to actually make that all happen. These were 2 teams of about 15, 20 people. They had an outsized impact on how we were actually understanding the outbreak and how it was moving forward. So we definitely want to work together with the civil society, with NGOs, in developing capabilities going forward and finding ways of actually working with you. And also, we're interested in if people have the kind of like the data science talent or the kind of ability to translate that information very effectively to decision makers. We would love to talk to you about potential, having kind of like rotator kind of engagement with you, where you would come and hang out with us for a little while, and then go back to your organization afterwards. We'd love to explore those kinds of opportunities as well.
I mean, I think you'll always have a very willing partner in civil society organizations. So be careful what you wish for. We might, come in and overstay our welcome, but just kidding. No, that would be great. And I know that some people are already going to be reaching out and sharing the slides. From Andre, I think you've answered it, but will CDC partner with other organizations to enhance, animal surveillance and ecology?
Yeah, like I said, I think that the National Science Foundation has been putting together various programs to really develop those capabilities. I used to work at the National Science Foundation. That's one of the places I worked in the Ecology and Infectious Disease program. So my background is actually in ecology and developing models to understand how diseases actually persist. Deadly diseases like rabies or plague persist in wildlife populations. So I have a very soft spot in my heart for trying to understand the ecology of these dynamics. But as I mentioned, it's like the programs at NSF and USAID are really robust, and they're developing some great capabilities there in terms of the research. We're going to be focusing more about ongoing outbreaks and how we can actually use that information more effectively to guide the decision making and the capabilities to make much more precise decision making in a time of crisis. Yeah.
That's great. And can you maybe I can bundle two of these questions. One is about a plan to partner with private sector in the future, particularly in the area of data science. And then from Kathleen, what will it take to require data sharing across jurisdictions? So not the same, but I'm going to bundle those two.
Yeah, no, thanks for the question. We're going to have to find different ways of working with the private sector, to be quite honest. It's, I worked in a handful of other organizations within the federal government that had different authorities to work with the private sector in a much more nimble way than what's resident at CDC. And there's been efforts to actually try to rectify that in terms of, it's like if you want to get really weedy, it's like in the other transactional authorities within acquisitions and that sort of thing. The CDC really needs to kind of like take advantage of those, among other sorts of approaches. We've already had one industry day where we're trying to highlight the needs that we're going forward. We're planning another one in Q1 2023. So we want to work much more closely with the private sector. We're trying to find other nimble mechanisms by which we can actually engage the private sector in a more robust way. But again, we need the private sector. We need the capabilities that they've developed in data technologies. We can't do this on our own. We need to actually find better ways of working together so that you understand what we're doing. And then we can also better learn from you what are some of the latest and greatest in these other areas so that we can move things forward. Now, I apologize. What was the second part of the question?
There's another, it was kind of what would be required data sharing across jurisdictions?
Data sharing across jurisdictions is going to be really challenging. It's it's been challenging for a long time. I mean, part of that is going to be required. We definitely need to reevaluate the data authorities that the CDC has in being able to actually require reporting of different situations and different sorts of data in a public health crisis. We need to think that through. We need to have more robust capabilities for CDC to do that. But on the other side, on the flip side though, too, on the data, on the locals, state and local side of things too, we need systems to make it easier for them to send the data to the federal government, and we need to make it easier for us at the federal government to accept that information. So that the technologies that we're using right now make it painful in some instances to actually report that data. So it's not only just an authorities issues, but it's also we need to actually enable the technologies to actually receive that information much more effectively.
Great. I have a question from Brian. It's still kind of on the localities. You mentioned that localities don't necessarily have funding or capabilities to share data. And funding, a question is always near and dear to any advocate's heart. How do you envision facilitating if they fundamentally lack those key resources?
Yeah, it's a great question. Thanks for asking it. And it's a tough one too. I mean, I don't think that CFA is going to be able to solve all of it, but there's a couple things that we're going to try to help make it better. Now, the first thing is that we're thinking about developing some opportunities where we can develop similar to what AMD has done, as like in centers of excellence. We're in the early stages of thinking that through, and then we would require partnering with local public health departments to actually effectuate that and implement that in some ways. And again, once we have that further developed and thought through, we'll come back to you and give you more details on that one. Another one though too that we've been talking about for a long time is this idea of a test bed, where we can design, build, and test different sorts of methodologies, different types of data, different types of decision support tools with localities to make sure that they're fit for purpose and they're actually meeting a need in an ongoing basis. And so it's this really interesting sort of yin and yang sort of situation where it's like before everyone had a mobile device in their hand, nobody really envisioned the gig economy. Nobody envisioned the ride sharing. So we had to have some basic technologies. We had to have some things for us to actually envision that world. And so we want to try to advance that through these testbed exercises. And then the last sort of effort that we want to figure out, we haven't figured out how to enable this going forward, but we also want to think through how to actually establish a fellowship program. We have a couple fellowship programs where people will come to the CDC and work in different programs within the CDC, advancing analytics and public health data capabilities. But we also want to push fellows to the state and locals in different ways, similar to the way they've done it with the bioinformatics fellowships, similar to the way they've done it with the labs fellowships. And so we're exploring those options as well. And so, like I said, I don't think that's going to answer all of those problems because it's a big problem, but I think those will help in some instances.
As you said, you're at a transformative moment. We have one last question here before I can turn it over to colleagues. From Vimala, I think this is an easier question to answer. Whom should we reach out to about a rotation program from a nonprofit organization?
Yeah, no, thank you very much for that question. We're really excited about establishing this. I mean, when I was working in the National Science Foundation in another lifetime, I mean, 80% of the staff at the National Science Foundation are rotators. They come in from academia, they're there for 1 year to 3 years, and they run programs and they push forward different ideas going forward. And then 20% of their staff are permanent. So they stay there for long, they have the institutional memory and everything. The intrigue of that particular workforce structure is that you have a flush of new people coming through all the time. So you're at the cutting edge of science going forward. That's exactly the kind of thing that we need within CFA as well. We need to be at the cutting edge of outbreak analytics, how to use different types of analytical capabilities to actually guide decision making. We need to be at that cutting edge too. So we are over the next 4 to 6 months, we will be developing this rotator program and figuring out how to do that, both for academics, for civil society, and for the private sector to come and work with us in different ways. And so stay tuned. We will have more details on that shortly.
So as they say, watch this space, right, for more developments.
Same time, same space.
One question from me, we're talking about applying all these lessons learned. We're talking about transformative moments. What do you think? And this is kind of taking off maybe the CFA hat and putting on some of your prior experience. What do you think that are the most poignant lessons learned that have come from the global collaboration in response to COVID?
Well, I think one of the things though too is that pandemics are extremely complex. I don't think that anyone would, debate that topic. I mean, the challenge that poses is that there's no one individual, no one organization that really understands all the complexity of how to actually respond to domestic and global sorts of issues, how to develop medical countermeasures, how to use data, how to actually develop different sorts of vaccination programs. We need to have kind of like a whole of society sort of approach to this. So trying to integrate across all of that complexity is going to be an ongoing challenge going forward. And so one of the reasons why I'm excited about it though too is working with my colleagues at the CDC. It has just been an honor and a privilege to see the dedication that these people have. And then also, it's like I said before, it's like the people that are on our team are just the best of the best, and I am just proud and honored to be working with them going forward. Yep.
Well, Dylan and your team, I thank you. We all thank you for the work that you're doing. It is tireless and it is so critically important to be better, to build better systems, to be better prepared. And I, from the bottom of my heart, very much want to thank you and your team. It looks like that's all we have time for today. This has been an incredibly informative and terrific discussion. Thank you for taking the time to speak with us and sharing about 45 minutes of your day. One quick announcement before you go, before everyone goes. I hope you'll join us next Wednesday at 1:30 for our next Alliance discussion featuring Dr. Adam Felsenfeld, Program Director for the Division of Genome Sciences within the National Human Genome Research Institute. A link to register is in the chat now. And we look forward to seeing you again, and have a great rest of everybody's day. Bye for now.